let's talk about cardiac arrest. So what is it? These are sudden loss of heart function due to electrical malfunction of the heart. And here the heart stops pumping blood to the vital organs of the body and also the brain. And here I'm talking about the blood rich in oxygen. And it can be fatal and not treated or acted upon the few minutes it sets in. So what are the causes? One of the causes include electrical disturbances. And here I'm talking about ventricular fibrillation and severe arrhythmias. Two, we have structural heart problems. Here include heart attack. And heart attack is simply the blockage of the blood flow to the part of the heart muscle, which end up causing damage or death to that part of the heart muscle, which can contribute to cardiac arrest. Other causes include the respiratory failure, severe infections. Yeah, we have metabolic disorders, drug overload, and trauma. What are the signs and symptoms? So the person will collapse, the person becomes unconscious, the person loses breath, there is no pulse, and the person becomes completely unresponsive. So this is what happens in cardiac arrest. Within 10 minutes, the person collapses and the person loses breath. Within 30 seconds, the brain cells deprive oxygen, or the brain cell loses oxygen. Within 3 to 5 minutes, the brain cells begin to die, and within 10 minutes, there is total permanent brain damage, and here is when death can occur. So what do? So you check for responsiveness of this person. If the person is unresponsive, you call for help immediately. Upon calling for help, you check if the person is breathing. If the person is struggling to breathe, if the person is not breathing, you initiate CPR. So upon initiating CPR, and if automated external defibrillator AED is available, you also administer the shock. So you continue with the CPR until help arrive. And while transporting this person to the facility, you continue with the CPR, yeah. And while at the facility, you can put this person in advanced life support for further management. So let me hear your comments on this. Yeah, thank you.